Hi, everyone. My name is Jamie Colvard. I'm the Director of State Policy at 0 to 3. Thank you so much for joining us today for our webinar, Engaging Families in Advocacy, Strategies, Practices, and Lessons from the Field. I can't tell you how excited I am for the conversation that's going to happen today, so I'm really glad that you're joining us. And I'm also so appreciative of our partners in today's webinar. You can see on the slide there all of their lovely logos depicted. We have the United Parent Leaders Action Network, Partnership for America's Children, Greater Rochester Parent Leadership Training Institute, the National Parent Leadership Institute, Washington State Association of Head Start and ECEAP Parent Ambassadors, MomsRising and Mamas Con Poder, and Start Early. Engaging families in advocacy is something we're really passionate about 0 to 3, so I'm so excited for today. I also just wanted to give a sneak peek that we're in the midst of preparations for one of our biggest annual family advocacy events, which is our virtual Strolling Thunder, not always virtual, but virtual this year, which will take place on May 18th. And this is when we connect a parent and guardian with their baby and toddler from every state and DC with their members of Congress for a virtual conversation about the experience of raising young children and what they need to support their baby's healthy development. I'll share information in the chat if you're interested in learning more about it, and hope that you take a look. Throughout our conversation today, I encourage you to share your questions for panelists and reflections on the discussion in the chat box as we go along. Note you can select whether to send that message just to panelists or to panelists and attendees, and that is really up to you. We will have time at the end to get to questions, and we'll get to as many of those as we can. A recording and materials will be shared on the 0 to 3 website next week, and we'll send an email out to everyone who is registered with the link to those materials. Before I hand things over to Erin, who's going to get us started, Dana, do you want to come on and say a quick welcome from Partnership for America's Children?
Sure, thanks, Jamie. I'm Dana Neymark. I'm a consultant with the Partnership for America's Children, and I just want to add my welcome, and we are so thrilled to be working with all of these partners. We're really on a journey to deepen our capacity for parent partnership, and we're learning a lot, and I'm really looking forward to the panelists today. So thank you all.
Thank you, Dana. Thank you, Jamie. Hi, everyone. My name is Erin Moore, and I am the National Director with the United Parent Leaders Action Network, or UPLAN, and I will be moderating today's webinar. UPLAN is a national network of parent leaders and parent leadership organizations working to improve the policies and systems that impact children and families. And you can find more at our website. The link will be shared at the end of the webinar. So I just want to walk through kind of what we'll be doing today on our webinar. You will be hearing firsthand from parent leaders and parent leadership organizations about their experiences partnering with decision-making tables of all kinds. The title of this webinar is speaking specifically to the importance of hearing and lifting up parent voice at policy and advocacy tables. Some of the parent stories and experiences you will hear today are also from parents participating in decision-making spaces at health systems, education systems, philanthropy spaces, but we believe those lessons apply too. So the bottom line is what you'll be hearing about today is parents saying nothing about us without us, and hearing best practices and strategies for how they've raised their voices in a variety of decision-making spaces. We will then conclude the webinar by distilling down some of the stories you've heard from our panel into some key best practices, values, and principles for partnering with parents and parent leadership organizations. Jamie kind of covered the housekeeping, but real quick for anyone joining us late, you can use the chat to ask questions of the panel, and this PowerPoint and the links shared will be posted publicly and sent to all registrants. So a few notes before we dive in. We have tried to make this webinar useful to advocates who come with a range of experiences partnering with parents. We believe that in every city and state, there are parents coming together to discuss and take action on the issues that affect their lives. But still, we recognize that in some places, the supports and infrastructure for parent partnership are stronger than others. So some of you may be coming to this webinar with relatively little experience partnering with parents and parent leadership organizations, and you might be in a state or a city where the networks of parents are less visible to you. Maybe you just haven't reached out yet to the organized parent networks that do exist wherever you are. On the other hand, some of you may be coming from a place where there is an activated constituency of parent leaders who are coordinating with each other, attending training, and backed by organizations whose mission is to build parent voice and power. And maybe you're from an organization who is already kind of along the journey of partnering with parents. Our hope is that no matter what context you're coming from, this webinar has something to offer you. While many of the stories you'll hear today involve parent leadership organizations with longstanding roots in state and local systems change efforts, we believe that a lot of the lessons, practices, and values apply even if you're just starting out with this work. Another note on parent partnership and equity. The organizations presenting here today have a mission to elevate the voices of parents who are historically and presently not often heard due to systems of oppression in our society. So the strategies you'll be learning about today are designed to lift up the perspectives of parents who identify as Black, African American, Indigenous, people of color, Latino, Latina, Latinx, Muslim, low income, working class, and disabled. We believe the wisdom of these families who have been systematically excluded from power is key to identifying the solutions for improving our systems and policies. And finally, we will be using the terms parent, family, and caregiver interchangeably throughout this webinar. Our intention is to talk about parents in a broad way, recognizing that in many families, it may be a grandparent, aunt, uncle, sibling, or someone else caring for a child. So with that, I am going to introduce our panel, and I will start by handing it over to Luva Alvarez.
Hi, my name is Luva Alvarez. I am the site coordinator and the parent leader of the Greater Rochester Parent Leadership Training Institute.
I'm Tina Carney. I am a parent leader from the Greater Rochester Parent Leadership Training Institute, PLTI.
Hi, my name is Toyin Anderson, and I'm a parent leader and a graduate from the Rochester PLTI. I also represent UPLAN, the United Parent Leaders Action Network, and NPLI, and I currently am in Rochester, New York. Thank you.
Hi, I'm Carolyn Lee Davis, and I'm with the National Parent Leadership Institute, and excited to be here. Thank you.
I'm Byron Jackson. I'm with the Washington State Association of Head Start and ECEAP Parent Ambassadors from Everett, Washington.
Lennox, Washington State Parent Ambassadors. I'm in Tacoma, Washington.
I am Shayla Arias with Mamas con Poder, MomsRising from Durham, North Carolina.
Wonderful. Thank you, panelists. So we will now open up to kind of the meat of our agenda for this webinar, where you will hear stories, testimonies, experiences, and best practices from each of the organizations and parent leaders represented on this panel. And once again, we will have time for questions and some dialogue following each panelist kind of sharing their experiences. So with that, I will turn it over to Tina and Luva from the Greater Rochester Parent Leadership Training Institute.
Hi, Erin. Thank you so much for this opportunity to be able to share this afternoon. Again, my name is Luva Alvarez, and I'm representing the Greater Rochester PLTI. So the Greater Rochester PLTI helps parents become leading advocates for children, families, and their communities. As part of the National Parent Leadership Institute, NPLI, PLTI expands the capacity of parents as change agents for children, as well as we help to facilitate parents' capacity to offer input into community efforts on the neighborhood, city, regional, and state level. In PLTI, we also facilitate systems change for parental involvement with increased utilization of parents in policy and process decisions. After parent leaders complete our program, they continue their leadership path, and we see that they are going on to sit at policy tables and work with advocacy groups. Here is parent leader Tina Carney, who will share her story of advocacy.
Thank you, Luva. Thanks for this opportunity. My name is Tina Carney. I'm a parent leader currently living in Rochester, New York with my husband and 3 children ages 10, 7, and 4. The guiding principle I'm going to speak to is recognizing that parents are experts on their own lives, communities, and the issues that affect their families. I've had the opportunity to participate in a few fantastic parent training courses over the last few years. Greater Rochester PLTI taught me that my parent voice is important and it's necessary for me to use in order to improve the outcomes for my children and all children in my community. Early intervention parent training taught me I need to be an expert about my children and the systems in order to best get them what they need. And additionally, I have learned from experience the power and support that comes from networking with other parents who face similar challenges. I'm going to talk about how I partner with parent advocates for change that will benefit children with special needs in regards to early intervention and struggling learners, including those who are dyslexic. Here's my early intervention story. When my daughter Meredith was 2 years old, this is 2 years ago, she qualified for early intervention due to a speech delay. Unfortunately, in our area, there wasn't enough providers, so she was placed on a wait list for services. Because of that wait, I joined my local early intervention council in my county and served on the executive committee as co-secretary. I started recording and sharing minutes in an effort to better connect all of the agencies, organizations, parents, and other stakeholders. This wasn't happening prior to that. And I recently developed and shared a proposal for the council to coordinate an early intervention awareness month coming up in September of 2021, where we plan to invite all stakeholders to participate and network with each other throughout the month. My dyslexia story, number 2. My oldest child, Brennan, is in 5th grade. Ever since he was in preschool, I had concerns about his attention and literacy skills. Every year, I expressed my concerns and asked teachers for suggestions. Answers ranged from give him time, he'll catch up, to maybe this is just who he is. I was skeptical. We had outside evaluations done and they indicated ADHD and language-based learning disorders, dyslexia and dysgraphia. My parent gut was right. I didn't know anything about learning disabilities, so I completely immersed myself in books, podcasts, websites, and social media support groups. I became an expert. I learned I wasn't alone, and I found other parents locally, nationally, and internationally with very similar stories to mine. Brennan, my husband, and I have spoken at Board of Education meetings about our concerns regarding literacy throughout the past year and invited others to speak up too. Last month, 2 administrators presented a new reading program that they're going to pilot in a month or 2. While no one directly said that this change was a result of our advocacy, I think it was. Great changes are slowly starting to happen in every state of our country, in part because parents are speaking up and working together to make literacy better for all of our children. My parents' trainings have taught me to trust my gut and to use my voice. As a parent, I am my child's best advocate. Almost every day, I'm contacted by a parent, guardian, or teacher with questions about what they can do to help their struggling child or student. I tell them that they're not alone, to trust their gut, and invite them to use their voice and speak their truth until they get the help they need. The future of my family and my community depends on it. My name is Tina Carney, a parent leader and expert on myself, my family, and my community. Thank you.
Thank you, Tina. Thank you, Luva. We'll go next to our next team of panelists, Toyin Anderson and Carolyn Lee Davis. Over to you.
Hi, thank you, Erin. Once again, my name is Toyin Anderson. And as I stated, I'm in Rochester, and I'm going to talk a little bit about building capacity. So the Greater Rochester Health Foundation is a local funder in our city. They partnered with NPLI, which is the National Parent Leadership Institute, to help the University of Rochester, which is a hospital located here, their behavioral health clinic, to better strengthen the relationship with the families that they serve. Parents go to the clinic because their children are having real mental health crises that require immediate attention. However, there is not enough service providers to meet all the needs of the children. As a result of that, the families were given and sent a letter that says, you qualify for services, but at this time, we don't have a provider to provide the services that you need. So parents were left not knowing what to do or where to go. So with this partnership that came about, the parents that sat at the table and through their lived experiences were able to ask the hospitals if they could help provide resources on that letter that went out to families so they can help themselves if the need arises. So from doing that, from having the parents at the table, the letter, we call it a resource letter, it was revised by parents and approved by parents and is now being sent to any family that has to wait to get services. So embedded in the letter are websites that parents can go to access immediate help for their children. Secondly, from this partnership, the parents asked to co-create a support group for themselves. Because what was happening while these children were seeing their service providers, parents were just sitting around with not a lot to do. So the families at the table once again asked for the support group to be started, and it's now currently being ran every single month.
Toyin, you ended up on mute somehow. Toyin, we lost your audio. You're on mute. Can you hear me, Toyin?
Can you hear me?
Yeah, but we lost you when you started talking about the support group meeting monthly. Then after that, we didn't hear you.
Okay, all right, I'll go over again. Okay, so the like I said, the families at the table asked if a support group could be started because while their children are receiving services, they were just asked to sit somewhere, not doing or have much to do. So they co-created this with the staff of the University of Rochester, and it's currently being held monthly via Zoom, given the COVID crisis, but they used to meet monthly in person while their children were being given services. And in this space, they are able to network, share resources among each other, learn from each other, and most importantly, the families felt very comfortable sharing their stories because it was very important to them to not feel judged because everybody in the room had a story of their children needing help. Another successful thing that happened from this partnership was the hospital was able to put on their main website more resources that parents can have access to if needed. So parents at the table vetted these websites, make sure they were definitely parent-friendly, user-friendly, and the resource that they offered was real stuff and updated frequently. And the reason, or part of the reason I believe that we had this level of success with this partnership is because the staff at the University of Rochester is very receptive to parents as true partners and valued their input and responded and committed to implementing the changes the parent partners requested. Thank you.
Thank you, Toyin. I'm Karen Linley Davis, and so Toyin and I were partners together with the National Parent Leadership Institute that created this project with the Health Foundation in Rochester. And I'm just going to highlight a few of the things that we found to be best practices that are critical to building meaningful partnership between organizations, staff, and parents. First, assessing who needs to be in the room and at the table. What voices are missing from this conversation? This is about racial equity, and this is about having the voices of those impacted by the policy or the advocacy issues at the table so that their lived experience, their perspective on what is needed is informing the creation of solutions, policy ideas, and the approach to advocacy. And so that you're looking around and really thinking, how can you start to take some next steps to add those voices that may be missing in the work now? So second is process time and money. So usually when looking at who needs to be at the table, who isn't there currently, that means reaching out to new people and folks that we may not have reached out to before and across difference and taking time to build relationship. So process time and money. Time built into the process for building relationship between staff, tables that already exist, parents, those who are already at the table and those who are coming in, so that there's time to shape things together moving forward. Opportunities to build capacity on all sides. Parents building capacity in their advocacy work and advocacy role, building on the passion and interest that they already have in these issues they're living. Staff building capacity in how to partner with parents and together shape advocacy agendas and approaches. Numbers. This is about not one parent at the table, but how can you have meaningful representation of parents to staff, to have a breadth of parent perspective and multiple voices informing the work, to set goals together, problem solve, and move together on action. In the Rochester project that Toyin was discussing, we were able to have equitable representation. We were working in this project in teams of 6 with 3 parents and 3 staff at the table together for each team. That equitable piece is not always possible, but we think it's always important to strive for it, and at least to make sure that you have multiple voices and you're moving towards representative and meaningful representation of parents at that table, so that it's not token or just one voice having to carry that weight of bringing the parent perspective. Facilitator, think about who is facilitating this conversation, who's at the front of the room in this work. We usually approach this with a team of 2 facilitators who reflect the community and who are diverse from each other to engage the whole group in the room. In the Rochester project, Toyin was the co-facilitator for the team at the hospital. That was critical. Staff shared back with us months into the program how invaluable they had realized having Toyin in that role was, not only to building trust with the parents who were being brought in for the first time, but also building trust with the staff and making that conversation as dynamic as it was. Representation matters. Removing barriers through budgets and logistics. So this is, in terms of logistics, this is something as basic as the timing of the meeting. Is it at a time that most parents can attend? Schedule with parents, don't announce a time. Think together about what time may work for the group overall. Budget, think about things like translation, digital access, childcare, transportation, so that none of those things are a barrier to bringing those voices into the work. Also for budget is building money for stipends so that the staff around the table, the staff who are around the table are often being paid to be there in that space. Parents are bringing critical knowledge to the work, and that's going to be critical to the success of it and honoring that work and knowledge with a stipend. And I'm just going to circle back to racial equity before I close. We know that in this work and around policy work affecting families and children especially, that it's critical that we work across difference. That's difference of income, education, language, geography, and especially race and ethnicity. And that when we do, our work is enriched by those multiple life experiences and perspectives. That's when we're best prepared to develop a policy solution that will be effective. So in closing, it's about looking around the table to see who may be missing, and then really thinking deeply about how you can take some steps through logistics, process, planning, and budget to begin to authentically bring some of those voices that are missing to the table. Thank you.
Thank you, Carolyn. Thank you, Toyin. So appreciative of your powerful testimony and experience. We are going to go to our next team of panelists, Byron Jackson and Sonya Lennox. Over to you.
Thank you, Erin. So the Parent Ambassador Program in its 13th year is a year-long peer-to-peer high-quality advocacy training program housed within the Washington State Association of Head Start and ECEAP Association. It is the leading parent organization and leadership initiative in Washington State. So through our unique model, each year, 25 to 30 parents with children 0 to 8 are selected through an application process to receive 150 hours of in-person and virtual training plus one-on-one coaching. They become a strong voice to advocate for early education funding and policy in Olympia and Washington, D.C., as our legislators make decisions that affect low-income children and families. Our intensive approach includes training on grassroots organizing, the legislative process, race equity, and leadership development, so parents learn to advocate for themselves, their families, and others to create positive change in schools, early learning programs, and communities. We really strive to empower parents with new skills, confidence, and knowledge to navigate systems and create change by being a voice at key policymaking tables. So the value we are sharing today is sharing power and involving parents in the decisions about the work, which is core to parent ambassadors. We were founded on the principle that parents need to be at all tables where decisions about them and for them are being made. Those closest to the pain should be closest to the solution. So over the last decade plus, parent ambassadors have fought for parents to be at important policy tables, work groups, rulemaking, and more. Our first real success in this was in the creation of the Parent Advisory Group to the Department of Early Learning. It was vital that parents were helping shape the development of the work of the newly created department overseeing all things early learning in our state. One of our very first parent ambassadors was voted to serve as the representative of the Early Learning Advisory Council, where we advocated to have parent voice represented. She was eventually elected as the co-chair of the newly created council. It was a huge win in our state in making sure there was at least one parent in decisions that were so important in the lives of children and families' everyday existence. From there, our work as an organization has really shaped parent engagement in our state, especially by state agencies. We are consistently working to put parents at every table and not just put them there, but make sure they're supported both emotionally and monetarily. So whenever there's a work group, you will most likely find a parent ambassador, either past or present. We work cohesively to find what interests parents have and match them with opportunities that come across our desk. We provide training and support on how to effectively educate, advocate, and use their voice to influence lawmakers and agency leaders or decision makers about policies affecting our families. So in 2017, the governor created a poverty reduction work group where more than 10 of our parents were a part of a creation of a 10-year plan to reduce poverty, improve communities, and make needed progress related to housing, health integrations, employment, and education. These recommendations were completed in December of 2020 and are being used in the creation and development of many other strategic plans throughout the state and in the legislature. One of our alumni serves as the co-chair for this work group. We have parents in spaces all over the state sitting on communities at the federal level as well. We know it is important to have parents at tables and not just being in the room, actually participating in the creation and development of decisions that affect them. Today, I bring with me Byron Jackson, who is a parent ambassador from 2020. Byron has been instrumental in passing some recommendations around prenatal to 5 children and the mental and behavioral health supports that families need in our state. So Byron, I'm going to pass it to you.
Thank you, Sonya. My name is Byron Jackson, and I live in Everett, Washington with my wife and my 3 boys, ages 9, 7, and 5. I came to be a parent ambassador in 2020 by being active for my policy council. The framework, family engagement, and Head Start gives parents the opportunity to be responsible for decisions, budgeting, hiring, and program operations. I felt I was not heard as a parent before joining the policy council. By feeling empowered through that program, I was on the Parent Advisory Council for Snohomish County ECEAP and later applied to be a parent ambassador, where I had opportunities to share my concerns, thoughts, frustrations, and appreciation for early childhood in a variety of spaces I have never been in before. Parent ambassadors is always finding space at tables where parents traditionally are not represented and are making sure we are at those tables. I was asked to participate in a work group on prenatal to 5 behavioral health as a parent of a child who struggled with the help he needed to get an autism diagnosis. The parental to 5 behavioral health work group membership It's nearly 80 diverse stakeholders of different race, income, and family situations. Robust conversations from parents and children with behavioral health needs, behavioral health clinicians, policymakers, advocates, physicians, and those familiar with Medicaid and private insurance led to recommendations included in the work group report to the legislature. These recommendations were not put forward without parent approval, and that is because of the work over the years with the parent ambassador staff laying the groundwork of true family engagement with so many stakeholders, work groups, and the legislature over the past decade. I am told through my parent ambassador staff that there are many things I brought forward that the facilitators of the work group are so thankful for me highlighting. I was just sharing my experiences and thoughts as a parent. Turns out it was important in shaping the work group recommendations. Some of the recommendations are closing health disparities for families of color, providing immediate relief to families, especially those who are most vulnerable, and focuses on the urgent needs of children ages 0 to 5. Through this work, I was introduced to others who are working on the same issues I'm passionate about, and now serve on the Interagency Fatherhood Council of Washington, operated by the State Department of Health, and I bring important expertise of reminding them that supporting parents participating in this work and offering their lived experiences is worth being paid for too. My time is just as valuable as someone with a master's degree who is making these decisions. Parent ambassador staff are always advocating for us to make sure we are supported in the venues we are invited to and that we share power, are not just checking off a box having parents in the room. Because of the work at the state level I have been doing, I was personally asked by the principal of my children's school to be on the equity work group to speak to teachers about equity. I am also on the Dyslexia Advisory Council for the Everett Public School District to recommend guidelines to screen kindergarten to second graders in the district on dyslexia screening in accordance with the state law recently passed. I am now starting to make changes at the K to 12 level that I feel important for true equity of our children. I have now seen the power of parents that have, and I won't back down knowing it's okay to speak up for what I believe in. If nothing else, I can always call on Sonya, April, Katie, or Joel to back me up. Thank you.
Thank you, Byron. Thank you, Sonia, for those powerful words. With that, we will go to our last panelist, Shayla Arias from MomsRising.
Thank you for this amazing opportunity to have me here. I want to thank each one of you for being here. Being here is the first step to accepting and acting for better outcomes, however your organization, you, or a personal level would like to take or apply it. Few things before I get to the UC part, what I call the UC part. I want to ask you to please have tolerance, be open, and before saying no or moving on, be open to navigate and hear different options. Hear me out. In 2013, while working at Durham Early Head Start as a health and nutrition coordinator, and as a parent of 2 kids who have benefit from this program at a federal level, I was given the unique opportunity to work for Early Head Start, but also to share my personal story at Capitol Hill in front of members of Congress, where I share the importance of early learning, Early Head Start, Medicaid, food stamps, also known as EBT. And these programs were also essential for my family during our lifetime in some different ways. Over the years, I have presented and continue to have the unique opportunity to present in many roundtables, to be part of really unique conversations, being able to not just speak for myself, but to be a side to side with other parents and motivate them, supporting them, encourage them, and using their voices. I love doing that. This has become one of my passions that I never thought it would be. This has also allowed me to observe and realize the things that are working and the things where we have plenty of room for improvement. I want to share these things with you. So please, please be kind to these things. You might have heard them again, definitely highlighting them all through our presentation, but just know the importance of meeting parents where they are is essential for changing in this world and our work. Why? Why is important for those to have authentic voices for our parents and guardians? Because if you're working with families, it all starts with our parents. Parents, guardians are the voice that represent our children. They are the voice for our children. Parents, they know our children. We know our children best. It doesn't matter whether you have a PhD in psychology or anything. We as parents, we who take care of our kids every day know our children best. We also as parents have these unique experiences that it comes with these programs and services and the need. We know what it takes to make changes because our unique stories are alive, true testimony of how the system, services, programs are not meeting us where we are. There are testimony of how things can be improved and how sad reality of how we felt and feel throughout this process. Why? Because roundtables conversations where families are being affected with whatever programs, law, proposals cannot be successful conversations without parents, without equal representation, diverse representations. A roundtable cannot be complete with just white people. We all need to be there. So here are some of the things that I think that we should consider. And these are just some of the things. There's also plenty of room to include what works for you. Think about having parents present at all time for an overall success. Meet parents where they are. And I think one of the presenters here, Carolyn, did an amazing job explaining why it's important to meet parents where they are. Providing interpretation, translations, materials, information as far as what's going to happen in this meeting beforehand, so we as parents feel well prepared for this. Think about childcare, think about stipends, think about dinner. You know, the struggle for us parents has been real and it will continue to be real. So being part of this conversation, it's already a huge step for us. But unfortunately, we do have other things that we need to worry about it. And that is providing food for our children, making sure that they're well taken care. So allowing us to have all these things beforehand, it is critical. Give parents a very, very welcome environment for these meetings. Put them around individuals that can support them throughout this meeting. You know, don't just put them aside or just wait for them, for the part of them to speak. Allow them to engage. Trust them to drive the car with you and take turns. Value these conversations, value this relationship. There's nothing more critical than building that trust with with us parents. And the only way you can deal is to nurture that relationship and value it. Encourage parents. I feel very motivated when I'm encouraged. I feel welcome to encourage other people. And I think it's already hard as it is for us. Having this encouragement for people that we look up to, people that we develop in this job is critical. And, you know, don't be afraid to give parents the platform. We're there as a team. And last, I want to share some of the things that have not worked for me as a parent that have really affected my voice at a table. Do not invite parents only because they look good on paper or because they need to become that check mark that you need to obtain more money for your grant, to represent your organization, or because you think you're meeting their requirements. Do not invite parents without having or providing what they need. And again, that goes back to making sure that all your parents have and you meet their needs. Do not have parents involved if they're not going to receive an update. I think it's very discouraging to be at a table where you put a lot of time and effort preparing your remarks, and then you don't hear anything about what happened or what's the outcomes. And then again, don't ever underestimate parents just because we don't have a degree. A college degree is very important and it's a motivation for a lot of things, but it doesn't mean that we as parents don't have our voice. So these are the things that I wanted to share, and I want to thank you for being here and for listening to me sharing a little bit of my story.
Thank you, Shayla. And thank you again to all of our panelists. On behalf of folks listening in across the country, I want to just appreciate the time, energy, and courage it takes to come and share these experiences. We're now going to move into some questions from me as the moderator of the panel before we get into recapping best practices and principles and some of your attendee questions. So the first question that I'm going to pose to our panelists is, why is relationship building important for organizations who want to partner with parent leaders? And what are strategies for building relationships? And I'm going to send this question over to Toyin.
Thank you again, Erin. I truly believe that relationship building is key. The word trust has to be the central focus of any partnership that you will build in any relationship. I want you to stop and think about the relationship that exists between your spouses or partners or children. You have to build trust. Even in little children, there has to be trust that develops for them to be able to be themselves with you. So if you think about a child or even the partner you have, if you don't trust them, and in any existing relationship that you have, if there's not trust there, there are a lot of things that will not happen. So if you stop and think about that, so you think about parents that you never even establish trust, how can there be a relationship? There will be none, because somebody has to be able to trust what you say, believe in what you say, to be able to see you as something or somebody that's valuable about what the things that you say are valuable. So you have to build trust. And it's very, very important that you do that, however best fits your organization. However, you can have parents come in and realize that they're valued, they're deemed as experts, and they are best fit to tell you what's happening in their lives. They know what their issues are, and they most times just need assistance in how to help make that better. And what are strategies for building relationships? Just treat parents and families as just human beings. I just hear Shayla said that parents don't have degrees, and that's kind of how some organizations put parents in a box, and that's not necessarily true. Parents out here that are not teachers, educators, and stuff, a lot of us have degrees too. We just do different types of work, but we know exactly what's best for our children, what's best for our communities, what's best for our homes. We just want somebody to assist in helping us, because that's not the area of expertise. But I believe that if you treat families as experts of their children and experts of their lives,
Toyin, we lost your audio, but I think we heard you up until if you treat families as experts on their lives, and I think you may have been wrapping up. Are you still with us? Okay, well then I'm going to go, I think we heard the meat of your response. I'm going to go to a next question from me as the moderator to our panelists. And I'm going to ask this one to Sonya. What are some of the common pitfalls when well-intentioned advocates and practitioners try to partner with parents, and how can these be avoided?
Thank you, Erin. I think just having parents in the space isn't true family and parent engagement. The key is to be authentic and transparent, and don't use parents as a checkbox. Parents need equal voice to those that are at the table, and they need to feel valued and listened to. And when you're partnering with parents, you need to understand the circumstances that our families are coming from and living in, and meet our parents where they're at. I think that when you invite parents into the spaces that they aren't typically at, partners need to think about supports that they might need to effectively participate. And a lot of this has been said before, but I think it's really important. I think that they need to be given the materials ahead of time. Maybe they need to be caught up on what's going on. Make sure that the materials are translated and interpretation is available if needed. I think offering parents stipends for childcare and gas is essential. And I think it's important to remember that one parent cannot speak for all parents, and parents at these tables need to be diverse. Policies affecting parents cannot be made without parent voice and supporting parents to be active participants effectively. So thank you, Erin.
Thank you, Sonya. I'm now going to go to our last question from me as the moderator before we go to some recap and your questions as the audience. And I'm going to pose this question to Shayla. Can you talk more about how parent partnership is a racial equity strategy?
Absolutely. I think we have all done a great way of really emphasizing this in our ways, through our experience, through our stories. But I really think that, my camera is not on, and I'm sorry, it's not turning on. But I think it's really, really important that we continue to look around us, and we continue to look at those tables that we have, especially now as we continue this year with great ways to change our laws and everything else that surrounds family. We need to making sure that it is equal. And when that means equal, like I tell my kids, they want to have 2 people on each side to balance it out perfectly. So that means that you can't have just 4 white people in a table and 1 Hispanic or 1 Black or 1 Muslim. We need to really consider to push this. We need to, I want to say, it's okay for white people to step down. I don't think that it makes them less value or that their work is not being respected. I think it's critical that the people that really, really have these stories that can really testify for all this need to be on the table. We need to allow ourselves to bring new people, diversity. We need to allow ourselves to explore. We need to allow ourselves to really, really consider moving, to have this balance equally, so we can really start working forward. I think there's a lot of us who continue to talk about racial equity, but we really, then we get to talk about racial equity. We have this conversation, this meeting, and we look around the room and there's only 1 Black person in the room and everyone else is white. So how is that going to be really racial? I think it starts within the organization, making sure that you have people that other people can relate to and develop that trust. I, as a Hispanic Mexican, I do have the hardest time really developing trust with certain individuals. They have no idea what the struggles are or the things that I went through. So having this racial equity balance out, it will allow other parents to step out forward.
Thank you, Shayla. Well, I'm just going to recap some of the key principles for parent partnership that we heard about from our panel, because I know I like to leave a webinar kind of with the information distilled down and really in a format that I feel like I can take home with me. So, recapping what we've heard so far, we've heard that it's really important to recognize that parents are experts on their own lives, communities, and issues that affect their families, and that it's vital to consciously share power and involve parents in decisions about the work. And I think I want to just lift up, this can really involve a culture shift in our organizations, right? A different way of doing business, communicating, and moving our agendas. We've heard about the importance of building relationships and trust. We've heard about the need to build capacity on all sides. Many of our panelists have lifted up examples of parent leadership development work, parent advocacy training, as well as on the advocate practitioner side, training on community engagement, racial equity, implicit bias, active listening, so that all parties are coming to the table ready, willing, and able to do this deep work. We've heard about the importance of centering racial equity and really making sure that in parent partnership, we're inviting parents who are the most often unheard to the table and supporting their participation. And finally, we've heard a lot about the logistics of removing barriers through budget and through planning, the time of meetings, stipends and honoraria, translation and interpretation, digital access, childcare, transportation, and multiple ways to register and participate. So with that, we are going to go to some of your questions from the chat. I am going to lift up a question, and Tina is going to take a stab at answering. How has COVID and having to be virtual affected your work? Do you think the strategies you shared would work in rural areas where internet is unstable and there are fewer people and people spread out? So that question is a lot, and Tina, I'll invite you to take whichever threads of that question you want to take a stab at.
Fantastic. Thank you very much. I think that COVID for my work, the good part of it has been Zoom has allowed me to get at more tables and more discussions because I don't have to travel. I don't need to get a babysitter. I don't need to make sure that things are taken care of at home. I'm sitting on my couch right now. My daughter's across from me taking a nap. It's been just so much easier to participate, and I've networked with so many more people in these last few months. The downside to COVID is that some of the parent advocates that I've been working with, some have had to step back to take care of their own selves, their own health, their own families, because we need to put our own oxygen masks on before we can help others. So there has been a lot of that too. So in some areas, the work has paused. And I think it's just important that we communicate those things and we respect that and hold places for those people and remind them, just come back to us when you can come back to us. I grew up in rural Western New York, actually, where there's no more cows than people out there. So I do understand the barriers to the digital divide. And I think that I mean, it's still there, but I think it's important to empower the parents that and the people out there to use their voices and lift up and say, you know, we need this. And just to ask for more access. That's something that I've come across too, is that the parents within my own school district, I don't think that they realize the power that they have in their own voice. So I think we just need to lift each other up too. Some people also think that pushing advocacy during a pandemic is insensitive and not responsive necessarily to what's going on. And I recognize that, and I am sensitive to that, but I need to be able to tell my kids if they ever ask me that I did everything I could to help them, regardless of the situation, to help them and their friends.
Thank you, Tina. I want to get to another question from attendees. What do you feel are the biggest barriers to recruiting parents to participate in advocacy, and how do you overcome them? And I will send that one over to Carolyn.
Thanks, Erin. Yeah, you know, honestly, I think, and I'm trying to catch up with the comments in the chat, and I missed them all, but clearly some of you are already engaged in the work of partnering with parents, and some of you are new to it. And so thanks to those who are already engaged in it. I think though, for folks who haven't been, you know, part of it's that opportunity to build relationship. So where there hasn't been relationship, building relationship and showing that this is a different opportunity and an authentic opportunity to partner together, where if that hasn't existed before, it can be hard at first for parents to trust that, because honestly, in some groups, they've been turned away and what they've offered up has not been honored or respected or acted upon. And so it's rebuilding from that. That might not be within your organization, but it may have happened happened with a parent in another organization. And so it's building trust and building relationship. And then absolutely to both what Shayla had shared and I had shared a little bit earlier, it's also thinking about what are those barriers that might be keeping them back in addition to a lack of relationship or trust that hasn't been built yet. So what are those pieces that if you built them in, it would really allow them to come to the table because barriers would be reduced. So thinking about transportation or childcare when we are back in person, thinking about technical access right now while we're virtual, thinking about translation if that's needed. So thinking about what can really show. And honestly, I will go back to that one of the timing of the meeting. That can be critical. If it's during when folks are in key times of working or family responsibility, it may just not be possible, but it can be really easy. And even by inviting parents to think together about the timing of the meeting, shows some of that trust and relationship building from the get-go. I would also just add inviting parents in as early as possible to the process. So sometimes it's clear that the work has been underway for a while and that parents are being brought in later on. And that doesn't help in building the relationship. But if you can bring parents into the work sooner and it's clear that we're building this together as a team, that is something that really engages parents in the work because they see how they're getting to inform and impact on the work.
Thank you, Carolyn. I want to acknowledge that there were a couple of questions that I don't think we're going to have time to address verbally today. I do want to acknowledge there was a very nuanced and thoughtful question about parent stipends and parent honoraria as relates to different types of roles parents play in advocacy work. I really want to lift up what Ellen Schumer from Kofi wrote in the chat in response to that question and say thank you, Ellen. I think the panelists would agree that the way you framed different roles that parents play in advocacy is a really helpful way to think about that. I do want to be mindful of our time, and so I am going to move us towards the closing of today's webinar. Once again, I want to just thank everyone who took the time to be part of this conversation today and for your deep and active listening to the wisdom of our panel. I also want to close by thanking our panel for taking the time to be with us today and share your wisdom and expertise. I know I personally have learned a lot today from hearing you. I will close by sharing some links to the organizations represented here. I encourage you, if you're sitting at home or at your virtual office thinking about how can I gather more resources and how can I connect with organizations across the country who have deep experience with parent partnership, there are some links here to the websites of the organizations represented. And finally, I wanna just remind everyone that we are gonna be sharing the links to the recording of this webinar, as well as the PowerPoint will be shared by 0 to 3, as well as emailed to all registrants as a follow-up. So once again, thank you. Just want to send everyone off with best wishes for health and well-being of all of our communities. Thank you.